Hey Study Nurse fam, Andrew here. Today I wanted to talk to you guys about note taking in nursing school. I tried many different methods of note taking before I finally found out what works best for me personally, and I would suggest that you do the same. But in this video I'm gonna show you a few general tips about note taking and studying, and then we'll move into writing out your notes versus typing them and the different tips I have for those. So if you like video content like this and you might find this helpful, give this video a like, hit subscribe to our channel. That way you get a notification every week when we upload our next video. Okay, without further ado, let's get started. So first off, whether or not you're writing or typing your notes, I would definitely suggest that you get a recorder, like a voice recorder. I just found a cheap one on Amazon. I looked everywhere for it and I haven't been able to find it. It's been a couple years since I've been in school, but I found this really cheap one off of Amazon. Sometimes I've even resorted to my phone if I forgot it at home. So I guess one thing to keep in mind with recording a lecture is to make sure, first of all, that it's not against your school's policy to do so, and second of all, that it's okay with the teacher. Although your school may allow you to record lectures, the professor may not find that very respectful. They may think that you're slacking in class and that's why you're recording it for later. There's a lot of different things protecting their information too. So just be respectful, and at the very beginning of the semester, just ask before you even attempt to record. Now, the professors that I did have that would allow us to record, they were very chill about it. They would let you bring your recorder or your phone up to the front of the classroom as long as the ringers were off, and you could just set it up by the podium while they spoke, and we would just all switch it off during break times and then resume it on our way in. But they were very relaxed about it, and I think giving them that option to deny it kind of helps you because they're less likely to deny it if you're courteous enough to ask. So take advantage of recordings whenever you can. Another tip for note-taking and studying that I have for you in nursing school is to always look at the PowerPoints ahead of class. This means if you're going to write your notes, maybe printing them out, I would suggest no more than 2 or 3 slides per page. I would always double side them, use the less paper as I could, and you jot your notes in the margins, or if you print them with note style, you have the slide and then the notes. That didn't always work for me. I found the lines to be kind of constrictive to how much I could write, so I just like to blow up the details of the slide and then write in the margins. My handwriting's good enough when it's small, so that worked for me. But always look at the PowerPoints. Don't just print them off. Look at them before the class period, because a lot of times, at least this was true in my program, professors will give you pop quizzes at the beginning of your class, and if you haven't looked over that PowerPoint, you're missing out on that grade and making a really good grade on that. A grade that most of the time is very straightforward. Like if you had read it, you would have scored just fine. But if you didn't, you're kind of relying on your best guesstimation of what the right answer is. So it can definitely work in your favor to read these PowerPoints, be prepared before class. Not only that, but it also lets you be exposed to the material another time. And the more times you're exposed to nursing information and materials, the better it's going to all start to connect and lay the foundation for the rest of your classes. So get that repetition in, prepare yourself the best for your class as possible, and hopefully that helps you succeed a little more too. I would also suggest that you keep a blank sheet of paper next to you. Anytime you have a question and maybe it's not an appropriate time to ask that question in class or during the lecture, just jot it down, and then when they give you an opportunity to ask those questions, at least you don't have to try and remember, shoot, there was something I wanted to ask. But if you have it written down, you can use that to ask your questions. Or if you're like me and you're shy about asking questions in front of a whole cohort of nursing students, especially ones that can be judgmental at times, then I would suggest that you use your office hours. Professors have those for a reason. It's not just to go complain about the grade you got on an exam or try to make up for that grade. If you have a sheet of questions that you need answered for clarification or to expand on the material to make that click for you, then take that with you. Go to their office hours, make an appointment. They love that. And if you come prepared with these questions, I can almost assure you they are going to see that as a great thing, because not only were you paying attention, you were engaged during the lecture, and you were thinking very critically about the information and trying to comprehend it. And then you went an even step further and came to them for that clarification and help. So this is a really great way to build up your relationship with these professors, and that can go a long way in your last semester when you're applying for internships, jobs, or even towards the middle or beginning of your program when you're applying for like scholarships. So having your professor on your side is definitely a great thing. Not only that, they'll see that you're trying very hard to learn the material and to work on getting better at it and preparing yourself as best you can. And if you were to not necessarily get the best grade on an exam, they're going to be more understanding of you and your situation than somebody who waited till the very day prior to the exam to even come address any questions with them. So go in advance, make an appointment, have that list of questions ready, and stand out from your cohort. Trust me. Okay, now let's say you have your slides printed off and you're handwriting your notes. I would suggest, and I've got an example here for you. Let's see, this is an old hematology lecture that I have. I printed off 2 slides per page, and that was because I could use the margins to write in, and that's why I printed them that way. It's double-sided, but I wanted to show you guys some of the highlighting that I would do. You always want to highlight anything that's repeated, anything that's specified to be on the exam, any words you don't know, conditions you don't know, things that stick out that you're not familiar with or that continue to be repeated. So let's see. So the pictures are kind of hard to see here, but I would jot some notes up here, and then you can see that there's a sample question here. I highlighted the answer, and then I gave some notes about the answer here. And then on the other side, this one says no adverse effects of tamoxifen. So obviously that was something that was emphasized in my lecture, and that's why I wrote it off to the side, highlighted it, and you can see down here I've got tons of notes in the margin. But that when you're highlighting, make sure that you keep a similar highlighting code among your notes. So if green's gonna be right answers, then always highlight the right answer in green. If you're going to highlight something that was repeated or specified that it's going to be on the exam in orange, then always use orange for that. So try to keep things very consistent among your classes, among your notes. That way you get used to seeing that, and you can just kind of skim through your notes. Oh, ooh, there's a red one. Maybe that was adverse effects of a medication, and you can remember with the color that it means that piece of information. So it can be very helpful when you overuse this and abuse this method. It can get redundant and no longer helpful. So be cautious with how you highlight, use it to the best of your abilities, and be strategic about it. If that means you have to color, put a little key on top of your notes, then do that. But be consistent. Another thing you can do when you're writing notes, and this can help you save time, this can help you get used to shorthand that you might see in your nursing career from doctor's notes, things like that, is to utilize different abbreviations, different mnemonics, things like that. So, and what I mean by this is, let's say it's a lecture on pharmacology for antibiotics. I don't want to continue to write out antibiotics all the time, over and over and over again. This whole lecture is about antibiotics. So I would abbreviate that as ABX, antibiotics. That worked for me. I don't even know if that's like a legit abbreviation that's approved for use in nursing or medicine, but that was something that worked for me. If you want to write and, maybe doing like a plus sign or the little ampersand, or for without, W/O. Little things that you can do that and will recognize, that won't take you extra time to read or interpret. That's going to help speed things up when you're writing notes, because these professors, they talk fast. They know this material inside and out, and sometimes they forget that you don't. So you have to keep up with them. And that's when it's important to remember to record the lectures if you're able, because then you can go back in and supplement your materials with that information that you may have missed. Now, one downside of recording and doing that strategy of filling in notes later, it can be a little hard to do if you're handwriting your notes, unless you're printing the slides, jotting notes in the margins, and even sometimes that still gets very crowded. There's not a lot of space. It can be hard to add in extra written information after the fact. That's kind of why I also defer more to the typing out of my notes. Some of you may not be very quick at typing, and what I'll say to that, unfortunately, is practice will make you faster. So the more you do type, the better you will get at it. But this is where a really good strategy can come into play when you type your notes. So one of my most important tips for typing notes and taking notes during a lecture, or even while you're reading, I didn't really take a lot of notes while I read. It was more during lecture, and then I would read for comprehension of the lecture material. But one thing you can do when typing your notes is to have those PowerPoint slides right next to the Word document. I would split my screen with 2 tabs, and you would put the title of the slide, and this is going to be in an outline format. Sometimes that's hard for a lot of students to get used to like, and let me tell you why you should like this, because it will change the way you study. So you have your slide, the title of the slide, that is your bullet point. So you have like A, and let's say I have an example here for you. So this is a GI lecture. Now, the topic initially is anatomy and physiology of the GI system. So my first title here is the title of the slide, anatomy and physiology. And it may just list mouth, swallowing, stomach, pancreas, gallbladder. It may just list those on the PowerPoint slide. And maybe you don't have all this extra information. But what you can do is get that outline typed up. Each new piece of information is its own line. And then when the professor starts to expand on the mouth, for example, you think you know the mouth, but they're going to talk even more about it. So when they talk about the mouth, maybe they tell you the function of the mouth, which I have as to consume food. And then the numbers underneath that are different information points about the mouth and how it plays into its role in the GI tract. So I have it mixes with saliva, like food mixes with saliva. The nurse would assess for thrush, dentures, any issues from the dentures, mouth ulcers, painful swallowing, gums, for bleeding and inflammation, or a paleness, which could be a sign of anemia. So maybe this is all what the professor's like spouting out really quickly. And if you're trying to write, you might miss some of that. And if you have it recorded, you can go back in and just type it in. And so here, I'll let you see it. Kind of what I mean about that, how each part of the GI tract has its own bullet points for information to help you expand on what that part of the GI tract does. So one of the reasons this is so useful is because, let's say you go to study later, and if you're like me, you are a flashcard person. I absolutely love flashcards, and people couldn't understand how I was doing so well on exams. Well, each line of information I would rephrase into a question and use it for a flashcard. I use Quizlet actually quite a bit, and I have my app already up. So this is pharmacology, and you can see I have so many different sets here, and they all have like hundreds of terms, which are questions. So let's go through drug therapy for seizures. This is from my lecture notes. So I would title it the chapter and put lecture behind it. That way I knew this was from the lecture material, not from book, not from my own personal notes, but from the lecture material. And so the first one is definition of a seizure. So on the other side, I have excessive or disordered activity in the brain. The next card I have, what are some of the potential causes of seizure? So if you were going through a lecture like PowerPoint slides, maybe they have the definition of seizure, what a seizure is, and then causes, and then bullet points. Well, is that really going to help you study if you don't understand why those causes cause seizures? No. So if you can understand each part of that slide, and I know they say not to memorize for the exam, but to be able to just understand the material. And while I believe and agree with that, I also think there's a certain amount of memorization that needs to happen so that way you can critically think. You can't critically think if you don't know the material. So making flashcards, simple ones like, what is a seizure? Bam. What are the causes of a seizure? Bam. And just reviewing those flashcards can help cement that basic information in your brain so that you can build upon it for subsequent lectures. So I really think that the outline format for note-taking on a computer is going to be so incredibly useful for you. This is like gold for nursing school, and it takes time to get used to this format. Trust me, and it's nothing really awesome to look at. You can put pictures in there if you want to or need to. I think I did sometimes, but it takes a lot of time. So this is the best way to be adaptive to the lecture, to review the information prior to your lecture, and then also set yourself up for success in studying after the lecture. Now, why is it crucial to have good note-taking habits and to make sure that you're reviewing the information prior to class? It's going to help promote retention of this material for you. Not only that, it's going to help you be exposed to the material more than one time. Now, let's say you follow that outline format and you type up your outline the night before, which is what I would always do. It makes sure that it's fresh in my mind for lecture. So I would type up the outline from the PowerPoint slides. So I'm reading the PowerPoint, I'm typing my notes, that's 1 or 2 times, depending on how you look at it, that you've already reviewed that material. And then when you go to class, you're hearing it. That's number 2 or number 3 times that you've heard or looked at the material. You're typing in extra information. And then if you go to like make your own flashcards afterwards, which is what I would suggest doing, because that material's fresh in your mind, you remember everything about the lecture. So if you take an hour or so to quickly make, Quizlet with the flashcards from your lecture, that is essentially 3 or 4 times you've reviewed all of that material before even starting to study for your exam. How much better do you think you're going to retain that material and perform on the exam if that's how you're studying? You're studying smarter, not harder. So find the methods that work for you. Hi, Gemma. Are you watching Mommy again? Come here. You guys gotta all say hi. Come here, Jim. This is Merlin. They always have to make a guest appearance. But anyway, so you need to find the study and note-taking methods that work best for you. That's not going to be maybe what your classmate uses that works best for them. But I would say you don't have time to waste in nursing school. You really have to be good at... Yes, Gemma. Mommy's wearing lip gloss. Thank you. You have to really be adaptive and... You have to really be adaptive, and if you study a certain way for your exam and your score is less than desirable, then change it for the next time. Don't continue to use that study method if it's not helping you. If you are an audiovisual learner and you're not allowed to record, supplement your lecture notes with YouTube, with different audio like podcasts. Look up different information about those topics you're learning and supplement your notes. Yes, they may not know what curriculum you are following, but anything outside of your program that might help you understand that material that much better can only benefit you. So look on YouTube, do a Google search, find something that's gonna connect that information in your mind in the most efficient way possible. You don't have time to waste. So go exam by exam until you find something that works, and then stick with that. Don't change a thing once you find what works for you. For me, that was the outline, the flashcards, and doing the flashcards so that I could approach NCLEX questions later on, like closer to the exam. Okay, guys, that's all I have right now for note-taking in nursing school. I really hope that you got something out of this video, that it shed some light on maybe a different method that you hadn't thought about. Don't be intimidated by the outline method. I am living proof that it works. And if you can think that way and use that method to your advantage, then by all means try your hardest to use it, because I think it's the best way of getting you information multiple times before you even start studying for your exam. And that's really, the repetition is really what's going to help keep that information retained in your mind, which is crucial in nursing school because everything builds upon itself. And if you're still stuck back in lecture 1 trying to comprehend that material and everybody is on lecture like 4 or 5, you've got so much ground to cover to get where they are, and you just don't have that time to make up that. So if you did like this video, please give it a like. That way I know to continue to put on videos like this. If you are interested in more nursing school, nursing profession type information, then be sure to subscribe to the channel. That way you can get a notification every week when I post a new video. I will be touching on anything from pre-nursing school, nursing school, new grad nurse, all the way through your profession. So, I'm all about helping you succeed in everything nursing. And I want to get you guys started off with this semester on the best foot possible. So until next week, I will talk to you guys later. Study Nurse signing out.